Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin. Wassalatu wassalamu ala ashrafil mursalin wa ala alihi wa sahbihi ajma'in. First and foremost, I'd like to take this opportunity to thank the organizer for inviting me here. Thank basically the Training and the Professional Development Division, Human Resource Department of PPUM. And I did my housemanship in PPUM once upon a time, long time ago. It's good to be back here and to share, in terms of from the experience that I've gathered more than 35 years on mastering the arts of leadership during turbulent time. I think before we talk in detail about in terms of what we should, listen and also master the skill, there are a few things that each of you might want to reconsider and be aware of the leadership skill. And there are five important leadership skills in each and every one of you, because eventually you are the leaders for yourself, for your family, for your department, and etc. So number one is that leader is not about you, it's about a team. Without a team, there's no leader. So it's a teamwork. So the teamwork is very important for you to work. And if you want to follow, to work as a team, you must have a sense of purpose, a sense of belonging. Once upon a time, you want to know someone that is actually performing or non-performing. You want to know someone, for example, you give them power. The moment they have power, they turn to be a different person. Before they get the power, they are a different person. So I think, this is why, if you want to know somebody, give them power. Yeah. Whether they become Power Rangers or they continue to serve. So leadership is about serving, inspiring your team, not about you. Once upon a time you thought that, once I'm leader, I want this, I want that. It's all for you. Then you are not a good leader. Leader is someone that can inspire. So teamwork. Now the teamwork, you can work as an authoritative team. That means my way, no other way. But that is the old way. But today I think is the best leadership skill is top down and bottom up. That means you lead. You are, we firm your decision, but you listen as well. You know what to do from your subordinates and etc. That's a very important. So you have to be part of the team, not a boss. But leader is not a boss. Leaders is a team. Together, then you can actually drive the department. So let's look at the 5 basic skills each and every one of you must have. Number 1 is the listening skill. This is the most important listening skill. And I use this character, this Chinese character, and I was taught about this Chinese character, not in China, but in Oxford Management Program. I attended the Oxford Management Program leadership course, 3-month course in UK. And one of the lecturer showed this program, this word, introduced me this character. Now, this character in Chinese means listen, but it is not one letter. It is a combination of various characters. You look into listen with your ears, so the character looks like a ear. Listen as if the king or the authority is talking to you, so you pay attention. Listen with your eyes, not your ears, eyes. Non-verbal communication, that is very important. Listen, at least one person is talking, one attention. And the most important, the patient will feel you if you are sincere. Listen with your heart. I still remember, when I did the walk round in this UM, and there's a patient by the name of Leong, and she had ITP and went for surgery. And obviously, I was the houseman. I come around and etc. And my rapport with patients, whether it's the Chinese, Indian, and etc. But very few of them knows that I can converse in Tamil, I can converse in Chinese as well. So I understand, but I wouldn't say I understand. So then I can actually listen to what they say, right? So one day when I was doing a round, and this patient lady was talking to the husband, and in Chinese, of course. So he said to the husband, don't let this doctor go. Don't let this doctor go, because this doctor, I called the doctor, come nearer to him, to her, doing the walk round. So he said, then the husband asked, why, what about this doctor? Then the patient told the husband, in Chinese, of course, but I just listened. So he mentioned just a very simple word to the husband. This doctor is not like other doctors. This doctor have a heart. So which means when you communicate with your patient, you cannot pretend. Patient knows that you're pretending. Baca baik ke apa, you pretend. But if you come from your sincerely for your heart, patient can feel you. Even though it's 1 or 2 minutes. Some of my patients, for example, come to see me, queue to see me. But I don't have time. I only have 1 or 2 minutes. And one of the patients told the trainee, my trainee said that, even though I see him for 1 or 2 minutes, I can feel him, So I think you all must basically, sharpen your skill in terms of how you communicate. Communicate sincere. And if people are not sincere to you, you can feel them. Tak ikhlas, the way they say it, the body language is not from the heart. So listening from the heart is very important. So mainly, the skill number 1 is listen. But today, in this day and age, is not only one person that you're listening. You have a platform listening to the facts, data, and science. Listening to the social media, what are the public talking about? Read and listen. And you talk about body language. So when you communicate, this is important. Communicate sincerely from the heart. This is sincerity is the key, and patient can feel you. We can feel the public patient. We can feel them. They can feel you. This is the communication. This is why negative vibe or positive vibe is very important. If you keep saying live in an environment with a negative vibes, then you become a negative person. But if you live in an environment with a positive, so you need to create that positivity. So skill number 1 is listen. Skill number 2 is that is communication skill. That is, every one of you need to engage. You cannot rule now. You need to engage with your patient. You need to engage with your peers in terms of never rule. This is the first advice from my professor Tom Reef when I was in the Royal North Shore Hospital. Hisham, never rule, speaks from the heart. The moment you rule, then you are exerting your authority, your power, and you start breaking things rather than make things happen. So once you engage, that means you create a bonding with your patient, with your peers, with your surrounding, and explain issues and challenges. In healthcare, there will be continuous issues and challenges. But more important is how you handle the issues and challenges together. First, explain the issue. You must understand. Patient must understand the disease. Public must understand the situation. Then once they understand, then you can actually come up with engagement. And more important is to know the audience. Manage the expectation of your crowd, your audience, your patient. Different audience have a different perception and behavior. For example, you want to manage orang asli, you must understand the culture and manage them. You want to manage the Chinese patient, you also must understand them. You want to manage the Indian patient, understand their culture, their religion. That's why, we came up in Ministry of Health those days, hospital mesra ibadat, so that we understand the Muslims' culture. But we also understand, in terms of other races. This is important. You are the healthcare provider. You are not treating one culture and one religion. You are treating others. For example, a Sikh, they have long hair. You don't come to the hospital straight away, you cut their hair, because that is actually, is their culture and also a religious requirement. They wear bangle. You don't just simply cut the bangle. These are the things that you need to engage. Be sensitive. And if every race knows their limit and they knows their culture, sometimes we don't know. That is our fault, because we did not have, to learn other people's culture. So basically is manage the expectation of the respective patient, audience, culture, and etc. Why do you need to manage the expectation? Because if you can deliver the expectation, then you win the trust. Once you win the trust, then you grow the trust over the years, and patient will come back to you again and again by word of mouth. For example, if you explain the patient, you're going to have surgery, this is the thing that you will go through, this is the experience that you go through, and when you deliver, the patient will trust you. Once the patient will trust you, by word of mouth will encourage other patients to come and see you in your discipline, for example. So it's important for us to grow the trust. Can you imagine if the patient do not trust you? Can you imagine the public do not trust the hospital? That is the beginning of the end of the hospital. So whatever it is, listen, build the trust, and the trust is based on your performance and your sincerity and etc. Okay, the third skill is in terms of communication. This is again in terms of communication. Today, not only individual, but communication using the tool that we have, social media, WhatsApp, so it's up to you how to use it. This is during the pandemic, 21st September and October. You can see in terms of millions of patients following in terms of, in my social media. But when WHO released the information, the highest impression, you can see 126 million people listening into following what you tweet at that point of time. And obviously, when I retire in 2023, I still attend a meeting in WHO. It's still 104 million people following, which means it's not only in Malaysia, it's not only the environment. The platform that we have with the technology now, whatever you say, whatever you do, people are reading and people are listening to what you are talking about. So these are the tools that you have to master. In healthcare, Singapore at one point of time, they refused to let their civil servant to use social media. Then until I communicate with them, because we are using social media every day. But the social media, you have to justify, not for you, you have to use it for the public means. Because there's the perception, become the DG, you got big office, and you sit down, and then you stay on top, you never go down to the ground. Takut mati ka, see. But when you have a social media, surgeon have a logbook, administrator, and each of you have a Facebook, right? This is where, when something crowd up, takut mati, refer to my social media, I was at the ground. I was actually in this place, and so everything can be traced and tracked. So that means you can share what you do. And most important is that, people perceive that you have a cozy office, and then you sit in the office, you're not going to anywhere. But when they see your itinerary of the day, multiple places and etc., then they know how busy you are. So this is again indirectly communicating to the public. So you must use social media. The hospital, your patient, etc. Some of my patients, those days, I start giving them handphone. They said, why are you giving a personal phone? Then because to communicate, if anything happens to the patient, I want to be the first to be informed rather than the patient go and see another doctor first, right? And I operate on the patient. Anything happens to the patient, let the patient text me anytime. But don't call me, because I may not be able to answer. But if you text me, I can answer there and then. Until today, if they text you, then there's a need for them to come in. There's issue, then they know when to text you. Not abusing the communication with you. So the third is that as a leader, you need to make decision, whether it's rightly or wrongly. As a surgeon, you need to make decision, operate or don't operate, right? This is the thing. Young surgeon, everything you operate. Old surgeon, you know when not to operate. Their wisdom is when not to do it. So which means you have to make decisions. Sometimes you dare not make decision. When you dare not make decision, then you are not a leader, because leader has to make decision because you have the fear of make the wrong decision. Yes, a professor used to tell me, a cardiologist used to tell me, when I treat patient, also our patient will die. Young patient, husband also treat patient will die. But the chances of patient dying from my treatment is very minimal. Chances of patient dying from a management from the husband is very high. So this is, again, you have to make decision and make wise decision. Sometimes you do not know whether your decision is right or wrong. But again, you need to follow your gut feeling, into your thyroid feeling, whatever feeling that you have, so that sometimes to make decision, you need to be in the environment. So, for example, I have been operating all difficult cases. And when I delivered the British Journal of Surgery lecture in Birmingham in 2013, our cases, was very challenging. And, the professor told me, in my lifetime, I have never seen this kind of cases. Seeing is one thing, but I don't know how you do it. The thing is that when you do the rounds, for example, sometimes you can feel, this is what I say, smell the air, feel the environment. You can feel this is a difficult case, but it can be done. But sometimes you are hesitate. Sometimes you can feel something is not right. Although this is a simple case, So that is the experience that you build over a period of time. The nurses, the doctors, you can build that. I'll give you an example. There was a VVIP came to Putrajaya Hospital. He went to UK, and UK diagnosed Cushing syndrome. Coming back with probably a 3 centimeters adrenal mass. Came to Putrajaya, VIP, everybody knows him. So I could have just listed him for operation next week, right? I have something in my heart, just not right, So, something I don't feel easy. Normally, young surgeon, straight away I will be very fast and in respond. So I delayed the operation for 2 weeks. Next 2 weeks only I did. And then sure enough, the next week, he had a myocardial infarct and then passed away from the infarct. Can you imagine if I were to do the operation there and then he have a myocardial infarct on table, and that is actually a disaster. So I think, again, feel the air. So if things are not right, there's a reason why. There is a message there. You can feel what's happening. I'm not asking you to predict, but your feeling. This is a very important, your feeling. So again, you need to make decision. Some of us dare not make decision, not trained to make decision. But over the years, you have to. In COVID-19, I think I have to make drastic decision. Not easy to close down, to have lockdown and etc. But that is what we have to do. For example, on the 8th of March, I was informed there was 15,000 people gathered in Sri Petaling Mosque. And when we went there, because one of the patients was positive and returned to Brunei, and then the health authority in Brunei contacted us. So we rushed to the hospital, the mosque. Most of them had returned to their own kampong already. So only about 500 people in the mosque. Then when we tested, 400 of them positive COVID-19. And we suspect that 692 of them came from Indonesia, bringing the infection in. So, and today genomic sequence has show us that it came from Indonesia. So what would you do? When you do not have medicine, when you do not have vaccine, you only have public health measures. How do you advise? So we know that the incubation period is 2 weeks. After 2 weeks, there will be spike of infection all over. And especially the tabligh group, they go from one mosque to another, one surau to another, and door to door, for example, it will spread the infection. What would you do? What would you advise the Prime Minister? And that's the decision that you have to make. And sometimes your decision is not popular, but you think that that is the only thing that you can do. Sure enough, after 2 lockdowns, we managed to, the projection, we have AI in terms of projection shows that it's a spike, but it did not happen because we have action been taken. So which means the third is making decision. Fourth, as a leader, again, Tun Mahathir used to say to me and to everyone, you must have creative ideas and innovation. If you do not have creative idea and innovation, it's difficult for you to be a leader. So not necessarily all the creative ideas and innovation comes from you, but listen to your subordinate, especially in your lower ground. For nurses, for example, they know the system well, they give you the recommendation and etc. This is how you can come up with creative ideas. Continuous, in terms of engagement with creative ideas and innovation. So I give you an issue, for example. We were all informed. We have now latest DAA, direct acting antiviral for treatment of hepatitis C, And obviously it's a good because you're not talking about palliative, you're talking about cure. But, in this DAA, high impact, very good outcome, but the cost is 80 million US dollars, 80,000 US dollars per patient. So at that time, 80,000 times 4 is almost 240,000, per patient. And I asked the infectious people department, how many patients do we expect? We have almost about 400,000 patients. And I told the Prime Minister, no way we can pay 80,000. So we negotiated, and then, negotiated with the company so that we are given voluntary license. That means we can use generic. Then obviously, Malaysia is in what they call that middle income trap. We are not rich enough to pay 80,000 US dollars for a patient. We are not poor enough to get a subsidy from the voluntary license for generic. So what do we have to do? This is the situation. This is the problem that you have. You have no access, and this drug is oral treatment. And it's tolerable as compared to the previous treatment, interferon and etc. You need to be admitted to the hospital, IV, and outcome is not that good. So what would you do? So then we have no choice. When you push us to the wall, then we have to innovate and come up with creative ideas. So we look into the application of compulsory license in HIV. So 2002, we exercised compulsory license. What is compulsory license? Meaning you just use your empowerment of compulsory license to break the break the patent from the company. So again, then we follow the TRIPS agreement. TRIPS agreement, we look into the detail of Doha Declaration. There are a few things you have to do before you can use the compulsory license. Number one is that you need to negotiate with the company. We have 8 sessions of negotiation with the company, refuse to give us the voluntary license, say that Malaysia, you can buy. So, failed negotiation. That's number one. Number two, you must announce that hepatitis C is a public issue, public problem. So then announcement was made. And then third is that you need to pay a certain amount to the company. So what we did is we exercised compulsory license. This is a journey. Once you exercise the compulsory license, we break the patent. Straight away from Twitter, the company offered us a voluntary license. But too late, we already started using the compulsory license. Now, when we use the compulsory license, a combination, there was the old combination, SOVO and DACLA, but now we came up, we already have the SOVO for the compulsory license. We explore new compound, and then Ravidasvir was the first to be introduced in Malaysia, a new combination. And we did a clinical trial. Ravidasvir and SOVO, the outcome is better than the current combination of treatment. Then obviously there's a reason for us to use. Then we realized that the treatment is cheaper. The diagnostic is more expensive than the treatment. So again, that doesn't make sense. When you have this treatment, it's $300 US, managed to bring down to $300 US, but the diagnostic is more expensive. Then we work with Foundation of Innovative a new diagnostic, and managed to have a point of care testing, positive or negative. And then you have a point of care testing, you have oral treatment, a new combination. Then our strategy have changed. Decentralization of treatment from hospital to the clinic kesihatan. Because it's oral, you can diagnose, you can treat. So the next strategy was finding the missing million. If we have 400,000, 400,000, then we can diagnose, we can treat at the peripheral clinic, for example. Again, then the treatment is 12 weeks. And recently, this is a 6 years journey, summarized to about 6 minutes. The treatment is 12 weeks treatment and costs about $300. And recently in December, when we partner with other countries, because this study is not only Malaysia, Thailand, Malaysia, Argentina, and other countries, and also we work closely with the Drug of Neglected Disease Initiative, and then we realized that we did a study of 8 weeks and 12 weeks. There's no difference whatsoever between 8 weeks and 12 weeks, meaning we can save cost another 1/3. Then from $100, then from $300, we bring down to $100. You can see the power of one thing leads to another. Then we register this as an essential medicine list under WHO. Then I was told that don't submit because we cannot compete with the previous combination. This is new combination, only a few countries using it. The old combination, the whole world, almost about 140 countries using it. But then I said submit. And once we submit, now we have a competitive edge that this cost is much cheaper and it's also shorter treatment, 8 weeks compared to 12 weeks. So one thing leads to another. What I'm trying to say is that you need to have creative ideas and innovation. If a leader do not have creative ideas and innovation, that will be stagnant. Second is that when we start to train our trainee, and we must inspire our trainee. And if the trainee is not better than you in time to come, then there's no progress. Progress means that your trainee today will be better than you maybe 5 years or 10 years later. You have to allow that. Sometimes a trainer felt so uncomfortable, threatened with the trainee, and then there's no progress. Progress means your trainee will be better than you in time to come, not now, in time to come. Now the trainee will learn all the basic about surgery, for example. Then once they have basic, inspire them to explore new tool to make things, better. How can they provide the services, high impact, good outcome at a reasonable cost? This is the thing. Then this is why we want our trainee to think, to come up with creative ideas. When I came back, I was always stunned with thyroid surgery under local anesthesia. And do you know that hospital PPUM was the first to report a series of thyroid surgery under acupuncture by Ian Cunningham way back in 1970. But during my time in the 80s, no one was doing it. Why not doing it? Because Ian Cunningham had 43 cases and 1 conversion to GA, but all done under local. So when I went to Australia, there was 1 case, that my professor said, tomorrow come to the operating theatre because this Mr. Clinton ejection fraction is only 20, we cannot do under GA, we have to do under local. So I came, without blinking, just concentrate how they do the surgery under local anesthesia. And we came back here, and when I read the paper from they were already been doing it. Then we started reading an article from Hong Kong. They're going to present 48 cases, the abstract, I just read the abstract, 48 cases of thyroid surgery under local. So we were rushing in terms of to get the patient to do it under local. And finally, we have 65 cases. We celebrated and we published the paper in Australian New Zealand Journal. And we were at the forefront doing thyroid surgery under local. Then, and not only me, my trainee all can do thyroid surgery under local. Then we did thyroid surgery under daycare. This was published in One Day Surgery in UK. And it continued to evolve. And obviously, thyroid surgery under acupuncture. So I have the opportunity to go to China. So I said, how can surgery be done under acupuncture? Doesn't make sense. So I thought that I want to go in China to accompany my minister, maybe criticize them. But when I went there and they showed me neurosurgery under acupuncture, thyroid surgery under acupuncture, and then I was blown away. And I make sure that, I follow the patient from the ward to the OT. And it can be done. So, and also they show me, and then the surgery is the same, just anesthesia is different. So then I went to another theatre, and I saw bypass operation is done under acupuncture. And then, open heart surgery patient is still awake. So how do you explain this? So and then then it came back. We came back. We follow the how they put the needle. You can put the needle using at the spot, and then you still use mechanical twisting of the needle, pressure, or you can actually they connect to electrical nerve stimulation, or you can use heat. These are the three examples. So the question is where to put the needle, how deep to put the needle, how long to stimulate, right? So we came back, we explore, and then I look into the anatomical, what we were taught. This is the Erb's point. Anesthetists will know the Erb's point, posterior, mid-posterior of the sternocleidomastoid, where your three nerves, great auricular nerve, transverse cervical nerve, supraclavicular nerve. And they only block, we only use local in the anterior border of sternocleidomastoid to block the transverse cervical nerve. But the Erb's point is equivalent to the acupuncture, point they call Futu's point. So it's the same concept. Just that they put the needle in that area, stimulate for half an hour, and this is once you stimulate for half an hour, you flatten the action potential of the nerve, no conversion, no transport of the impulse, and then eventually there's no pain that being felt. That's one. So that is actually the local block. That's how I explain, and it works. Second is that they use the Hergus and Neguan's point. Hergus, when you stimulate this point, there's a release of endorphin of the brain. This is exactly, we use midazolam, we use petidine for the central block. So again, a study was done. I look at PET CT scan where they stimulate Hergus point and then they stimulate a control other area. Other area have no release of the endorphin. And when they stimulate at the Hergus point, PET CT scan shows there's a release of the chemical in the brain. So again, this is central block. So at the technology, so we came back, we started doing it. The first patient, it was successful actually, but my locals already ready. In case it fail, I can inject and continue do operation. But they don't use the local. So we did our first patient, a thyroid surgery acupuncture in Ipoh. So again, this is what I'm talking about, creative ideas and innovation. In your field, learn the basic, what people are doing today. And then from that basic, you understand the basic, then you come up with creative ideas. Now you have more tools, laparoscopic, you have robotic, you have everything. But I will go for frugal innovation. Innovation that costs less rather than cost more. Obviously, thyroid surgery can be done under robotic. It can be done, but should we do it? No, when the cost goes up to 100 times, for example. So frugal innovation, high impact, good outcome, reasonable cost, that kind of procedure is marketable. So I think this is why you need to embrace creative ideas and innovation in your field of expertise. So obviously, when you have challenges, for example, this is the tawakal. Tawakal sometimes is that you must work hard first before you leave everything to the Almighty. Sometimes you don't do anything, we leave everything to the Almighty. That's wrong. Do as your best, then only you call you tawakal. It means you have done your best in terms of your effort has been put in, then only you tawakal. So, Almighty will never give you a challenge that you cannot overcome. During the pandemic, we do not know about the future. Can we overcome this challenge or not? The huge pandemic of the whole country. Believe in the Almighty, that if the challenge will not be there, if you are not able to overcome it. But you have to work hard, not only individual, teamwork, whole government, whole of society, all come together, alignment, and then probably you can win the war. So this is, again, we always believe. Sometimes, I still remember in ENT, for example, in HKL, there's one ENT, Indian surgeon, before operate, he will go to a corner, he do some prayers first. Which is good. That means he is actually engaging with the Almighty before he start the operation. We also, when we do any procedure, when you do any procedure, at least you start with Bismillah, right? With the name of Almighty, and then you hope that all will be done. And you need to perform, and also you need the blessing from Almighty. I think this is something that gives you the confidence that you can do things better. And it's not for yourself, but it's to help the patient. Intention is very important. Whatever you do, start with the intention. Innama a'malu binniyat. All the good things or all the work that you do must start with a good intention, right? Okay, that is the 5 basic things that I would like to talk about. Let's talk about the challenge, the pandemic crisis. Now, when the pandemic happened, and then we heard about the pneumonia of unknown cause in China, it's already good enough for us to alert and know that this eventually, because the world is getting smaller, eventually, the virus will reach our shore. So how are you going to be prepared? And this is why you need to fall back on facts, science, and data, communication, and etc. And I see all the things that we have learned, we must document it so that we know what to do in future when there's another pandemic. So we heard about it, we got prepared, and then we called the lab, 23 labs, private and public together. How do we diagnose? We can't diagnose a virus when we do not know the genomic sequence. We do not even know the name of the virus then. Until China released the genomic sequence of the virus, PPUM and Ministry of Health, we primed the lab, and then we are able to diagnose based on the genomic sequence that been released. So this is important. Once we can diagnose, then you can fight the war. How to fight a war with a virus when we cannot diagnose the virus? So again, this is important in terms of collaboration with other countries to release. In the past, when there's an infection, they try to hide. They don't talk about release, hiding the information, hiding the cases, like Nipah virus those days. When they have a Nipah virus outbreak, Ipoh, they transfer all the ill pigs to Bukit Pelanduk, for example, because they try to hide. Once you try to hide, then once you cannot control, then out of control. So now, one of the things is that we need to share the information so that our neighbors know what to do and how to diagnose, this. So we listen to the World Health Organization, and this is part of the IHR. And IHR, and we know that the weakness of IHR, that's why there's amendments to the IHR led by Ashley Broomfield in WHO to strengthen how we coordinate. So when there is a pandemic, public health emergency of international concern, WHO will take consideration into 3 factors. Number 1, the virus is spreading like wildfire, very fast. Number 2, fatality is very high. Many people succumb to the disease in a short period of time. Number 3, they have to take into the most difficult, economic impact when to deal with it. These 3 factors, WHO will sit down and before they declare a public health emergency of international concern. So again, what is more important, what we have gone through the pandemic COVID-19 for the last 5 years, but the more important is that, the health security is a national security. And we need to work as a team, whole of government, whole of society approach, not only PPUM, not only Ministry of Health, but to everyone. I think it's important during good times, we get all our SOP ready, know what to do, rather than spinal cord reflect only during the crisis. So what can we learn from this pandemic COVID-19? And more important, my greatest fear is that we all have forgotten. All the lessons learned from PPUM, for example, how you have creative ideas and innovation. Remember, China can build a 10,000 beds hospital in 10 days. 10,000 bed hospital in 10 days. We, Malaysia, in 10 years, so I'm not sure ready or not. Right or not? But again, creative ideas and innovation. We can have a 10,000 beds, mobile hospital, for example, in Maibs, for example. So we can have that. So creative ideas. We can change a ward to become ICU within 48 days. 48 hours, not days. 48 hours we can change. So a lot of creative ideas and innovation came about. And then obviously our hospital, before the pandemic, already congested. What more we talk about during the pandemic? So we can use the field hospital, convert the hall, the public hall to become a hospital and etc. How did we do it? I think that's the lesson that we need to exercise from time to time. So again, we were lucky because we have this Act 342, that is a Prevention and Control Act. And obviously, sometimes now looking back, we may not realize that we have a strategy. You want to fight a war, There is a strategy to fight a war. You just cannot just go in and fight. No, there's a strategy. The first strategy is, using public health response. That means we do not have medicine, we don't have vaccine, only public health response. Public health response means avoid being infected. That is the first line. So avoid being infected, stay at home, put on a mask, wash your hand, avoid crowded places, confined spaces, and etc. Avoid being infected. But in the West, for example, in Sweden, and also in UK, they started with herd immunity approach because they protect the high-risk group people, but the young one, because your immunity is very good, they expose the young ones to the virus. I mean, you can, without a mask, you can go around, and hopefully when you get the infection, and then once you recover, you have a natural immunity. That was the idea. But at that point of time, we do not know about this virus. Although it's a coronavirus, but it's a new form of coronavirus, a mutated coronavirus. Then they realized even the young ones succumb to the infection, not the elderly, the young ones. That's why they went back to a public health prevention and control response. And because of we have this Prevention and Control Act, it's much easier for us to implement. So we need to look back in terms of our system. We have a CPRC, National CPRC. We have a hospital CPRC. I'm sure PPUM also, you have your own audit of the hospital. You know how many beds you have, occupation of the beds, occupancy of the beds in ICU, and you monitor your equipment, your vaccine, your everything, your PPE, your mask, everything. You must tip top with the information, and then only you can respond accordingly. Otherwise, the hospital will be congested. And then the system today, whether you like it or not, we need to invest in IT so that with the click of button, we know the information. How many beds has been occupied? How many beds vacant? How many ICU beds available? And then what our stock for medicines, stock for PPE, stock for masks. Everything must be there and then, because the response is within 24 hours. So again, this is the behind the scene in every CPRC in the country. I'm sure the UNISTEAM layer is also part of it. And obviously, once the decision been made, that is announced that this is a pandemic, public health emergency of international concern. This is the approach that we have. Just going through surveillance and public health intervention. So we use surveillance and public health intervention to make sure that the infection can be controlled, rather than infection in your body, fighting in your body. Try avoid the infection. Second, diagnostic tests. We also realize that PCR take time, maximum from 20. All the labs only can do about 3,000 tests a day, but infection sometimes more than 10,000 in one day. How are we going to test? Because we do not have a capacity. So there will be a delay testing, meaning the infection control the spread. So we work with other organizations, again, like FIND, to come up with the PCR, for example, point of care testing, and then you can test there and then, and whether positive or not. Then movement control order, that means we try to limit the movement. This is the thing that, and then whatever we do is evidence-based, based on the facts at that point of time. Because the fact today might be obsolete, but at that point of time, the facts is available, and we have a 6 months of grace period to learn from other countries, from UK, from Sweden, because they have the infection first, what works and what doesn't work, and then learning from them. This is where it's a dynamic process of innovation. And isolation, positive cases we isolate. Those exposed to positive cases also we isolate. So these are some of the experience in a nutshell that we have learned from the past. So I think I just mentioned, we started with this 9th of March, whereby there was 16,000 people gathered in Sri Petaling Mosque from 23 countries. And that is the beginning of the spread of the infection. So this is why we advise the government of the day at that point of time that we need to use public health measures, because if we do not, within 2 weeks there will be a spike infection. Not from me, this is a projection from the computer systems saying that in 2 weeks time Malaysia will have a spike of infection from Perlis to Tawau. So what do you advise the Prime Minister? Wait until the spike or take action now? Action means you have to limit an MCO, and you need to engage. Again, most important, the key success of how we manage pandemic COVID-19 is the daily engagement with the patient, with the public. obviously this is the training that I got from surgery. When you have a, breaking of the bad news, the consultant will send the most junior to talk to the parents. I was always the most junior to break the bad news. So over the years, we learn how to communicate, with parents, for example, how to empathize with parents. So when I do the press conference, I look at the camera as if I'm talking to one patient, right? And this is how you communicate, and then sincerely, if you do not know, say you do not know. You do not know, be honest, and, then be calm. You cannot be panicking, if you be panicking, the audience also will be panicking. I remember when I did one follicular thyroid cancer in operating theatre, and it was in the chest, a recurrent follicular thyroid cancer. So I have to split the chest, open up the chest, remove the cancer. And we all know that follicular thyroid cancer is very vascular. So it was swelling, bleeding. So everybody was sweating. I was sweating, dripping. Blood loss was almost 15 liters. 15 liters of blood loss. Then my trainee, Kepochi next door to see what's happening. And then the anesthetist will say, "Hey, we are running out of blood, 15 liters of blood loss." So, so I have no choice to pack everything and close up. And the anesthetist told me, "Okay, do we need to do a tracheostomy?" I think we push him to the ICU, and then after that we declare him dead in ICU, right? So that is the thing. Again, as I said, we do our best. Our anesthetists have given up. My assistant have given up. Everyone have given up. I also have half-heartedly almost given up already, but we just pack and close up. But remember, Almighty says not over yet. Have not given up. So we push the patient to ICU, and then patient 2 weeks time walk home actually, right? So which means, although the surgeon, you just need to do your best. And every raya, he will send me a big Hari Raya card with the music and all that. See? So that is what I said, although I was sweating, bleeding of 15 liters, but patients survive. Again, sometimes we just need to do our best, and then let the Almighty do the rest. So this is, I think you have to really, coming up from experience, this is the thing that, again, challenging cases, but if you do the best, you know what you are doing, and then you just have to do some prayers, and then maybe that's the best. So engagement, this is a strategic communication. Many of the healthcare workers, nurses, doctors, we are poor in engaging with patients. So you need to develop this skill of engaging with your patient, because you meet patient all the time. Yesterday I was engaging with medical student. So they asked me, how do you decide a career? So I asked them, do you become in a medicine, for example, in a medical field, are you interested to see patient or not? So I'm not interested to see patient. Then it's very clear, do parasitology, microbiology and all that. Then I said, do you like to see patient and talk to you or not? So I'm not good in communication. I don't like patient talking to me. Very good. Then you do forensic. Then patient won't complain. Everything keep quiet. Right. So okay, you like patient? Okay, like patient. Then I ask them again one question. Do you like to read or you like to do? I like to read. I don't like to do. Procedure, I don't like. I just like to read. Then it's very clear. Medicine, pediatric. These are the two. You read only. Every day walk around, read. And then continue to, come up with lateral thinking, lateral, and then come up with the patient's treatment, etc. Right or not? Right. But if I like to read, also I would like to do. So at least, in terms of endocrinology, I have the knowledge of endocrinology. I can manage patient. Even in Kuala Terengganu, we do not have endocrinologists, but I manage pheochromocytoma myself. And then Prof. Khalid came to it. Who is the endocrinologist? I'm the endocrinologist. Who is the surgeon? I'm also the surgeon. So I can treat and I can manage. So then, to become a surgeon, you have to ask yourself, if you like to do you have fine skill or you have rough skill? If you have rough skill, then you use orthopedic, hammer and all that. Very clear. Orthopedic is your field. Obviously, orthopedic also have fine skill, for example, spine and etc. But if you have fine skill, obviously neurosurgery, and then your ear, your eye, these are all fine skill. Endocrine is also a very fine skill. So this is how you decide. obviously this is just a guideline, but at the end of the day, it's you. What do you like to do? So this is how you define. This is how you engage. This is what I learned from PPM. This is what Prof. Asma, when he was a pediatrician, taught me how to think. What do you want to do? Because that's the same question I asked her. How do you decide what specialty you want to be involved? So this is the same question he threw it to me. And today I'm throwing it to the younger generation. So again, engagement in terms of strategic communication is important. The way you talk, risk communication, talk to the patient, and then be sincere in a way. So sometimes we need to strike a balance between economic and health. We need to strike a balance between life and livelihood during the pandemic, for example. So this is why when we declare public health emergency of international concern, we look into the virus, spread like wildfire, fatality very high, economic impact. So when towards the end, now we can control, virus is still there, but fatality have dropped. Because after vaccination, we used to have 500 deaths a day. But after the program of vaccination, the death is less than 5 cases. So that's one. That means fatality is down. Economic impact, huge economic impact if you continue to have lockdown, etc. Lockdown is not a means of cure, but then it's only to buy time for us to get the vaccine. So China have a prolonged lockdown, it doesn't work. So lockdown is only given us time to get the vaccine as soon as possible. And that's because of that, there's out of 1 out of 3, that's not strong enough for us to declare public health emergency of international concern. What did we learn about procurement of vaccine? So we realized that, Khairi Jamaluddin managed to, our health minister, procure the vaccine, but only for one country. I realized that when we talked to my friend, Dr. Clement from Vienna, for example, he told me that, in EU, they bought the vaccine on behalf of 30 countries. When you have 30 countries, your volume is very high. If your volume very high, you can negotiate with a company. Buy 10, get 1 free, get 2 free, for example. So the cost will be much cheaper. That's why they get the vaccine first and also at reasonable cost. We paid everything, the vaccine in December 2020. Vaccine only arrived 6 months later. And then Brunei, a minister also approached me to loan some vaccine from us because the company said, no volume, this is our price, take it or leave it, right? If only that we use the platform of ASEAN. Indonesia have 250 million population, Malaysia 30 million, and then Thailand, Indonesia, ASEAN platform, bigger volume, cheaper price, and then faster delivery of vaccine. So this is something that we need to learn. Today, we are the chairman of the ASEAN. I hope we can take this lead. And we already started engaging at the ground level in Singapore. I have 2 meetings in Singapore, one in NUS, and recently in a public health meeting to talk about how can we work as an ASEAN platform in terms of procurement of vaccine, procurement of medicine, pool procurement, and then we can actually cut costs. For example, if you PPUM, you buy a vaccine or you buy certain medicine from only for your hospital, you have a small volume. But can you imagine you partner with the whole Ministry of Health and then you bigger volume? I'll give you an example again. There was an outbreak of dengue in our country in a couple of years ago. And, then we were questioning why the GPs are not doing the dengue testing. You should diagnose early. Then we called the GPs. The GP said, the test kit costs 90 ringgit, 90 ringgit. Plus consultation and plus medicine, it come up to 150 ringgit. It's too expensive for the patient. So what did we do? So we look into the GPs. We have 8,000 GPs because when they purchase individual from the clinic, from the company, that is their cost, 90 ringgit. So when we pull together the requirement from the Ministry of Health and the GPs, we managed to bring down from 90 ringgit to 15 ringgit, 15, right? You see? And recently, before I retire, I have this initiative in terms of identified 82 medicine, 82 expensive medicine, pull together 3 ministries: Ministry of Health, Ministry of Higher Education, including PPUM, and Ministry of Defence. And then we have a cost saving of 176 million. Same medicine, but because of volume, you can get cheaper. So if only we can open up this, explore how we work together, because sometimes we look in silo. And pandemic COVID-19 taught us not to work in silo. Like, for example, we share the vaccine. Ministry of Health bought the vaccine for everyone. You don't need to pay. How to optimize your resources, your beds, how to optimize training, and etc. So I think these are some of the lessons I learned that we can actually continue to improve. So next is behavioral science. When you engage with your patient, and when I engage with the public during a press conference every day without fail for last 1 or 2 years, and it came into the Guinness Book of Record, every day have PC, right? Not because I want to have PC, because I was forced to do it by the Prime Minister and the Cabinet. Why? Because it's not only health crisis during a period of time. It was also a political crisis. Remember, 2 weeks you do not have a government, and we're still running. And what do I mean by political crisis? You got health crisis, you have political crisis, and obviously lead to economic crisis. So when you have a political crisis, if a politician is one talking, then opposition will start to criticize, right? Not because politics and politics, right? If the minister say A, they will say B, right? So this is definitely. So the Prime Minister at that point of time said that we want a professional. And this is exactly what happened. Do you remember Kim Jong-nam's case? So I told the minister asked me, Hisham, you go to HKL and do a press conference. I said, why be? You are the minister, you go ahead. Because this is geopolitics now, right? Not only local politics, geopolitics. So he said, no, this one, you can, you can win or you can lose big, right? This is the thing. So they said, no, you go ahead. You go and do the press conference. The first time in history I went into the hall, there are more than 300 reporters around the world, right? And obviously I have to put a lab coat as if that I'm a forensic expert. I'm not. I'm just trying to communicate. So I read the information well, and then after, reading, everybody can read, right? But the Q&A is important. How you answer question. Your press conference, you can go up and just read the statement, bye-bye, thank you. That's it, fine. But the Q&A, the questions, how you answer is important. So that's where the challenges is going to be. So again, these are some of the behavioral science that you need to understand. Because in any discipline now, we realize that mental health is important, behavioral science is important. And last 2 years ago, we championed this behavioral science in World Health Assembly, and the motion has been passed, and now is part of the clinical practice of behavioral science. What do you mean by behavioral science? When you want to change a behavior, you must be clear with your messaging. A good leader, Tun M, for example, when he communicates very simple language, very simple, words that they use in orang kampung also understand. The aci, uncle, aso all understand, right? Simple messaging. So, meaning to say, when you want to talk to your patient, use simple language. They are not professors, they are not academicians. Use simple language so that they can understand. So that's number one. Second, continue to repeat. And sometimes we get fed up. You talk to the son, and then another son will be there, another daughter will be there. You continue asking the same question. Then you fed up already, right? Then uncle come in, the auntie come in, asking all the same question. Must be patient. Explain again and again and again, so that drum in. So every day we are repeating the same question, and then every day we repeat the same answer. During the press conference, the reporter asks the same question, and then the next reporter also asks the same question. Tomorrow ask the same question again. Again, be patient. Continue to repeat, then engrave in the public. This is what to do, what not to do, right? That is the key. Third, obviously, you give some incentive. So, for example, you already vaccinated, then we give you a bit of freedom. Then you can move here and there, some perks here and there, incentive, nudging from time to time. So this is how you change the behavior subconsciously, over a period of time. Continue to remind. So when we talk to our patient, breast cancer, for example, when you break the bad news, continue to remind them, and then to remind the family, and then they understand the subject. Now, patient is very smart. Before they come and see you, they go to the internet, they read everything. They want to make sure that doctor understand or not. So what they have, they pretend. We also can feel them. They pretend as if that they don't know. Then they ask the question and they already have the answer, right? But sometimes the worst thing that can happen, doctor do not know. And if these are latest information, you don't know. But you must have some, intelligence in you. So open up the computer and then read together. Then ask the patient, you also know, they also know, right? Rather than they have all the evidence and then contradicting you, right? So this is where I think we have to work smart in terms of work together. Patient is no more authoritative. That means you tell the patient what to do. No. Patient is our partner now. That means you tell them, and this is what we're going to do, and then by all means, can you get a second opinion? Always allow second opinion. Recently, I had one breast cancer patient, already shopped 5 hospitals in a private hospital, 5 hospitals, 5 surgeons, met 5 surgeons already, came to me. So again, I engage with them. Again, I give them, get free hand. You can continue to have second opinion. Allow second opinion, not a threat. If they want to go second opinion, please do. So again, this is again, build trust and confidence is how you engage. When they have trust and confidence, they come to you. If they do not have trust, allow them to get the second opinion. So this is again behavioral change. So again, just to simplify the whole 7 component of our readiness program, SOP. Public health, you have SOP, the do's and don'ts, what the recommendation to the public. Then you must have an alert system. If there's outbreak in one area, there's an alert system in the area. Today, everybody have handphone now. So you can use the handphone to come up to alert. Meaning, for example, there is outbreak of dengue. You move to that area, already there's actually warning that this is a high dengue area. Then you take precaution, for example. Testing. So strategy of testing. Now point of care testing is available. Everyone, you have cough and cold, you can test yourself. Negative, you stay at home. Or you want to go out, put on a mask. Protect you, from infecting others, your family members, and etc. And self-empowerment. We want to empower you, so you know what to do, what not to do. In China and in Japan, for years, if they have an upper respiratory tract infection, they will stay at home, or they put on a mask and they go out in public. So these are the good behavior. Digital, and then now we can, have a super app, for example, find, test, trace, isolate, and support. My Sejahtera and etc. So that we can open up our economy as soon as possible. It's all these systems already in place. So now you have all the system, WhatsApp and etc. Do we have a proper app that can be used during a pandemic or during an outbreak, not only for communicable diseases, but also non-communicable diseases, so you can nudge you from time to time. So these are some of the key that we need to really talk about. Then just look into this publication in 2004. This is not by me or not by any one of us in Malaysia. The best practices for the government agency to publish the data, that it was cited. Malaysia have done everything that we could think of, the best practices, become a role model for other countries to follow suit. This is from all the Mat Saleh, not from me, showing that we have done all the right thing, and this is why sometimes, we do not appreciate what we have done. And worse is that, my take is that the new government will always negate the previous government. And the next government will negate the current government. There's no continuity of flow. So, during the political crisis, I'm caught in between because the opposition attacked me to get to the government of the day, right? Because of politics. I'm not involved in politics. I'm not a politician. But the government of the day sometimes use me to defend against the opposition on the wrongdoing. Again, I cannot support as well. So I'm caught in between, getting firing from both sides. I say A, opposition say B, because not for me, but they want to attack the government of the day. So things like this. Worst thing can happen, opposition become government, government become opposition. Then I'm still the same, you can get attack firing on both sides, right? So what I just want to educate the public is that, you must be transparent about what you do. And obviously we can answer. If I say R naught opposition, then say, no, we don't use R naught, we use K dispersion. So I ask, what is K dispersion? Couldn't explain to me. The whole world is using R naught. So again, when you do something that you also need to refer to other countries doing it, then you got the benchmarking, how you do things. So a lot of challenges, and I made a statement, the most difficult challenge during pandemic COVID-19, it is the handling the politician, right? That is a fact, right? Very difficult, because you're caught in between. I mean, working. I mean, as a surgeon, we 3 days on call. I have been in this hospital operating from 8 o'clock in the morning until 11 o'clock during the fasting month. And you know how we break fast with one straw only. That's it. The nurse will give you one straw during the breakfast in this hospital. So, which means working is not an issue. But sometimes these are the challenges that we have. But again, we have to be honest, and then we just say what is right, rather than, if I were to say for the challenge that I had, closure of parliament. I know the government of the day wants to close the parliament because there is the no confidence votes, in trying to avoid the no confidence votes. And then opposition also, if you close the parliament because avoid the no confidence vote, then you die. If I were to close the parliament blindly, I have no power to close parliament. Advise the speaker to close the parliament, and then based on, no scientific fact, I'm already gone, long time ago, right? But what I did is, no, if you want, then we test, and then certainly we test the member of parliament, the people in parliament, testing, and then shows 11 cases COVID-19, Delta variant, CT value less than 15, meaning just started only, right? So what would you do? You do, you die. You don't do, you die. So when you got that report, and then some politicians say, you fake the report so that you close the parliament to benefit the government of the day. And then I'm not a politician, but what would you do? So I have no choice but advise the speaker to close the parliament for 2 weeks. The speaker is very happy. Everything referred to me. The advice is from the KP. So I get the firing from both sides. The government of the day very quiet. Then the opposition all attack me left, right, and center. And nobody defending me. I just kept quiet. But the parliament closed for 2 weeks. And I was also threatened to come to the parliament for a PAC meeting. So I went to parliament, put on my mask, put on my shield, to attend, then try to explain. So I explained, but again, they are not very convinced of this. They thought that this is a stunt that I'm trying to make to help the government of the day to remain in power. No, I just closed the advice for 2 weeks, so that in 2 weeks we got a lab in the parliament. Everyone that comes to parliament do a test first. RTK antigen negative, you go in. You debate until 12 o'clock, also I don't care. But if positive, you stay in your car, don't come in at all, because you will actually transfer infection. Then we got to realize that the infection was spreading in Surau because there's no ventilation in Surau. And most of them got infection, 11 cases there. And then, so we put a lab, then we have a shield, and we improve the ventilation, and 2 weeks. After 2 weeks, 102 people got infected from the parliament and 1 died. So looking back, have I not closed the parliament, advised to close the parliament, more death, then they'll blame me. Why didn't you close the parliament, Leah? So you do, you die, you don't do, you die. So again, this is something that, again, at that point of time, I was very depressed, very stressful, but I don't know whether I'm doing the right thing or not. And some of my seniors, in public health from the private end calling me, if I were you as a DG, I will allow the no confidence votes to continue in the parliament, allow the parliament to carry on. Yes, but if the death is 500 or 1,000 people got infected and died, who will be blamed? The DG. See, sometimes, again, as I mentioned, the 5 things, sometimes you need the Almighty to help you to make decision. So this is whether you have to make a decision, close or no close, right? So these are some of the challenges that now looking back, I can share. Of course, those days were very stressful for me. And then the government of the day did not defend me, not even a word, right? So these are the challenges that you have to go through. And obviously, everybody knows the story of Parliament. That's why I'm talking to you. Everybody knows about it. Everybody can read about it. But this is the experience we have gone through. How can we make a right decision, right? If I have a crystal ball, I'm very confident I can, what's going to happen. So very confident we can make a decision, but we don't. So that's why I think you need to depend on your instinct. You can call instinct, smell the air, instinct, gut feeling, thyroid feeling, whatever, But that will actually guide you, to be sincere. Otherwise, the new government come in, the first thing they do, they kick me out first, right now. Because DG play politics, right? But some accuse me, I have tempered the IMR report, in the 11 cases that it's positive. accused me. And some said that, all the things that have been said. But at the end of the day, evidence shows that because we are based on science, facts, and evidence, say otherwise. So that's where you can actually, whatever you do, again, we are professional. Professional needs evidence. The moment you make decision not based on professionalism and based on political, then you die politically, right? So you fight with sword, you die with your sword, right? See the other thing. So again, what you do in today and future is all based on science, facts, and data. Okay, so this is the term that we use. We take care of ourselves, our family, our community, and country. So to bring people together in terms of a social responsibility. That's why we are here to do medicine. And I just go through very shortly about this mental health. Again, it's very important during crisis. All of you, 30% of us have this mental health crisis. The fear that we infect our family members, and all these the challenges that we face. See, these are some of the distribution of what we can use to assure it's important. The leaders must ensure, must support, give a psychosocial support, and to lead your group, your team, and then some form of therapy, address the issues and the concern at that point of time. So you can see that, in terms of how we spread the information using infographic, now you can actually communicate, you can talk, you can text. There's actually a national mental health organization and can help you online, counseling, etc. So hopefully that you can actually engage with them. So we hope that we can make these responders, for example, to get the support that they needed. And again, as you can see, you got the line, you can call in, and then there will be psychosocial support on the other side to help you and to advise you accordingly. So this is during the period of pandemic. But not only pandemic, even in normal times today, they need psychosocial support, and that should be. See, you can see that once we started the intervention, the text messaging, and then you can see the complaint will be less. And then that means, we can address the issue much better in mental health. So, emotional support, information about the COVID, and then sometimes they need assistance. They have family problems, so complaint, psychiatric problems, violence, and etc. These are all the issues. Then you try your best to come in to address the issue for them. Sometimes being there to listen is also a part of management. So some issues, as mentioned earlier, and again, these are our group that work 24/7 actually during the pandemic and even now. Now let's talk about in terms of communication. Then we've been identified, three of us been identified, actually led the IHR, International Health Regulation Amendments, because we see there's a weakness in IHR. So they actually managed to do all these amendments and completed amendments. Then I was appointed by World Health Organization to be the chairman or the president of the Standing Committee of Health Emergency Prevention, Preparedness and Response. Very challenging because we have 194 countries, and to come up with alignment from 194 countries is not easy. You got Russia, you got US, you got China, you got US, and then you have Iran, you have Palestine, you have Israel. Very difficult to come to work together, or geopolitics. So, before I start the meeting, I want all the 194 countries to agree the guideline and the principle of the meeting. The principle number one is that we all are here in 194 countries here to support the World Health Organization. That is why we are here. Otherwise, why should we be here, right? So everybody agree. Okay, we are here to support the World. Second is that we need to prioritize. Basically, there is 1,500 emergency response every year, but we cannot be dealing with 1,500. So we need to prioritize the emergency. Third is that there are multiple committee. We do not need to repeat the committee in terms of repeat the things that have been done by others. For example, PBM is doing dengue study, and UKM also doing dengue study. UKM also, KKM also doing dengue study. Keep repeating. Resources is still the same. So we say we do not need to repeat, but we work together. The fourth is the most important. That is actually, we need to focus in our discussion. Why? Because during that meeting, they will talk something else. Important. Israel will talk something else, and everyone, Syria will talk something else. Nothing to do with the agenda of the meeting. They will talk non-stop. Until the cow comes home, also they're still talking. It's not that it's not important. It is important, but it's not related to your agenda of your meeting. So always focus in the agenda of the meeting. So all agree. So when they start talking away from the agenda of the meeting, we say, no, that's not our agenda. So otherwise, they'll try to raise their geopolitical issue during the World Health Organization. And last but not least, as a surgeon, whatever we decide, it must be practical and simple, implementable. That's a thing. So all agreed to these 5 principles. And it's not easy. When Palestine have 10 minutes of intervention, Israel also wants 10 minutes, sometimes wants 15 minutes, right? You say, so this is a thing that you have to say no to them. This not easy to manage geopolitical problem, right? So this standing committee. So the appointment is 2 years, 2022 to 2024, until last year. So I completed my term last year, and these are the things that we have decided. So we make it simple. When there's a pandemic, we need a multi-agency ecosystem. And more so in Malaysia, we need to know our networks of network. In terms of how the system works. Where do you buy the glove? Where the glove coming from? And then where do you buy these medical devices? Everything. You know who is the supplier, and etc. So this is important. So we agreed, very simple, because when you chair a meeting like that, you cannot think micro. Being an administrator, you have looked things at the macro level. The more macro, the better it is. But being a surgeon, you have to be very micro. You cannot see RBC, right? You cannot see blood during operation. Very micro. So this is the 2 things that you need to play around. So the macro is the 5C. C number 1 is collaborative surveillance. Meaning, as I mentioned earlier, when you have an outbreak, you know the genomic sequence of the virus, you must share it around the world so that others use your information so that they know the kind of virus they can get ready. So this is one of the things. Whatever information, surveillance, you must share. Second, community protection. You cannot hide the information from the community. That's the reason why we have a press conference every day to tell the community what to do, what not to do. How to prevent infection, and then have a platform to answer all the doubts, disbelief of the community. And this is important. They have a lot of questions, you have to answer. Your patient will come to you with 1001 answer. Sometimes they're at home, they can all the questions. Come and see you, they forgot everything, right? So always tell them, when you have a question, write down so that you can forget. Once you come to the clinic, I'll explain everything that you have written. So this is important for you to address some of the concern that they have. Community protection. So then community know what to do, what not to do. You protect them. Third is clinical care, safe and scalable. That means how you can scale up your ICU beds, for example. You got 10 beds, you can scale up within 48 hours to have 40 beds, for example. How you can convert a ward to become an ICU. All these, stockpile management and etc. in the hospital level. This is a clinical care. As I said, we cannot build a hospital, 10,000 hospital in 10 days, but we can build a field hospital of 10,000 beds in 1 week. See, much better. These are the innovation, creative ideas, as what mentioned. Then, until today, we are still discussing about countermeasures of vaccine, diagnostic, and therapeutics. So, how do we distribute? Because the rich country buy everything. They buy the glove, they buy the PPE, they buy the vaccine. The poor country have no access. So, there's an inequity. How do you make sure that equal distribution of diagnostic, vaccine, and therapeutic? So this is where the discussion comes in, and then WHO have 6 hubs. For example, comes under Western Pacific region. We also must address this issue together, so that you can actually equal distribution of diagnostic, therapeutic, and vaccine. Then coordination emergency. Now, when there's an outbreak in one area, for example, Sabah, there's an outbreak, then we can mobilize our team in Terengganu, in Kelantan to Sabah, manpower, equipment, and etc. This is mobilization. Not only in our country, but if there's actually in our region, ASEAN country, we can mobilize the team. Field hospital, for example, recently there's actually earthquake actually in Myanmar, so we can mobilize our team, field hospital to Myanmar to assist them. So these are some of the 5C that we have decided. So sustainable healthcare, whether you like it or not, is we need political leadership. Someone that can speak, someone can get the support, top down, bottom up. This is important. And if leadership do not get involved, nothing happen. For example, we are talking about healthcare financing, health transformation. We've been talking about more than 45 years of transform, nothing been done. Why? Because there's no strong political will to transform the health system. Why? Because they dare not. So everything that's free. The moment you take away the free and then you had the payment, then you lose the political ground. So a lot of challenges in terms of this political will. So we need strong political will. Leaders, as well as the head of departments or head of the university, you must have strong, clear political will. And this is where we need to embrace Kaizen. Kaizen is, Japanese way of empowerment that is actually to work with a sense of purpose. Every morning you come to PPEM, you know what you are doing, you have a vision, in terms of sense of belonging. Employer must also take care of employee. Very important, because employer use employee but do not take care of them, there will be a crack in your system. So, top down, bottom up, this is why you must create a sense of belonging in your company or in your hospital. See, Toyota, for example, when they develop Toyota, they have these vendors have a sense of belonging to the company. For generation, they serve the company, right? So this is why they have a sense of belonging. And in our field, that's number one, sense of belonging and sense of purpose. Second is that you embrace Kaizen. Kaizen is small step of improvement. Every day you do, then you can see improvement in time to come. Small steps will eventually build up to be a better environment. So again, together we can make the impossible possible. Together we can actually overcome all the obstacles that we have. So I mentioned earlier the 5C. And again, communication. They just look at this communication. Anti-vax, say that, the vaccine can cause blood clot. Can it cause blood clots? They ask me the question. I say yes. The moment I say yes, front page, vaccine can cause blood clot. So I have to explain to them, the 4 cases in 1 million vaccination, 4 patients will have risk of blood clot. And if you are a smoker, your chances of developing blood clot is 1,763 times. Itu dia tak nampak. Dia nampak the vaccine saja. Right? See, information be distorted with the misinformation and disinformation in social media. And birth control pill, we all know, it can cause a blood clot as well. And obviously, if you get the infection, without the vaccine, the chances of you to get a blood clot is 165,000 times per every million people that actually have been vaccinated. So I think these are the the chances. This is how we explain to the public based on data. The public hanya tahu vaccine cause blood clot, but not smoking. Looking at smoking, then you realize how high smoking can cause blood clot. So again, when we use AstraZeneca, we know AstraZeneca can cause blood clot. That's the reason why AstraZeneca vaccine is not in our national immunization program. And also we have a precaution for them, the high risk group that can get blood clot, for example, even though it's only 4 in 1 million. But try to avoid the elderly, the risk group, and etc. So again, now let's move towards the next one. 5 important lessons that we learn. Number 1, digital health. Whether we like it or not, in this day and age, we have MySejahtera, Super App, and now AI is coming into our system. Not to avoid AI. We need to embrace AI. Once upon a time, when we have the computer, some of us say, oh, don't allow our children to use computer. Then they will be obsolete if you don't allow them to use. It's likewise, AI is the same thing. In China, the school children are being taught AI already. So we need to embrace AI, whether we like it or not. This is what's coming. Otherwise, it will be obsolete in time. Second, as I mentioned, communication risk. We need to engage, we need to explain, we need to manage the expectation of our customer, our patient, and then to build trust. And then we can grow along the trust. If every one of you have a strong trust being built with your patient, imagine the hospital will have a bigger trust from the community. Then, as a leader, creative ideas and innovation. As I mentioned earlier, then whatever you do, you need to persevere. Istiqamah is very important for sustainability. And adapt to science, facts and data. Again, sometimes we can only plan, but Almighty have the last say. You do your best, and then let the Almighty do the rest. Let's talk about in terms of some of the future in the human-techno interaction. In terms of RI 1.0 and then continue to move on, you can see the spectrum changing from 1980s, 70s, and then until today. Digitalization. So now it's coming to AI, more personalization, etc. The care is also changing following this trend. And so the snapshot, this is an old slide that I have taken. Look at MCMC have reported those days. We have 32 million population. Internet user already more than 25 million. Today, probably about 30 million. Broadband penetration is more than 100%. And mobile cellular penetration is also more than 100%. Sometimes some people have 2 phones already. And then smartphone penetration is the same. Active social media, now not only social media, we use WhatsApp, Facebook, Instagram, X, and etc. But now they are not talking about social media. They are talking about content media. That is TikTok. They are talking about content, not only social, but content media. So these are all coming. The way we do business, connected to the internet. Paying, you go to the shop now, pay to your PayPal and etc. All electronic now, no more cash. And government agency also is changing now. E-commerce is coming into play. These are all the new environment that we are going to face. So again, when we look into healthcare, we must first look into primum non nocere, first do no harm, quality and safety of our care. And then we focus on the illness all the time. So now we need to shift the pendulum from illness to wellness. Prevention is better than cure. How do you shift this pendulum in terms of prevention? Then healthcare back to the community, and then empower the community rather than doctor knows everything. Community, family, and individuals come to play. Fourth is the inclusive innovation and smart solution. This is ongoing with the new tool, AI and etc. A lot of innovation is coming into play. Then collaborative partnership. We cannot live in silo. We cannot work alone. We need partners now. Partners not only in medical fraternity but across the board. Then public and private integration coming in. Let's look into the Global Agenda 2018. This is the platform. WHO is moving towards digital health. So the few platforms available now, and they are still continue to enhance digital health. And moving forward in 2019, WHO revealed a reform in terms of access. This is much important for us to adopt data analytics and delivery of healthcare using the technology. So let's look at the technology. As far as leadership is concerned now, in terms of you need a vision to have a sense of belonging. Digital governance, political commitment in digital governance, politics will give us the framework, advocacy and monitoring the situation. But you look into the access, the facilities, whether we have facilities, patient, data, infrastructure, connectivity, and these are all the capabilities of the skill and talent, and that we need to build, and we need to work with other ecosystem, other partners to enforce and enhance the healthcare system. So policy will have to change to adapt to the new environment. Remember, it is not the strongest, it is not the most intelligent of you that will survive, you and your community. It is the community that can adapt to the environment. This is a new environment, whether we like it or not. So, see, things are changing the way we practice now. The patient access and ownership, the data, medical records belongs to the patient. Patient can access to the medical records. Now, if the patient is not available to access to the medical records, you need a court order. Then only you can actually access to the medical records. So what if the patient manage their own medical records? This is the one thing that we talk about. And then, cloud services now, cloud-based, in terms of funding, in terms of, so we look into different platforms. Internet of Things, for example, genomics coming into a practice, 3D printing, robotics, blockchain, and all these are coming into practice. Radiology, for example, if you 1 million slides of chest X-ray and know all the reading, and then they will come up with algorithm, the AI can read for you. Today, you want to write essay, you just ask ChatGPT or DeepSeek, and then they can actually write an essay for you, right? All the points. So things are changing. We need to adapt this new environment, and hopefully we can perform better. Look at the digital technology now. Some of the things, stethoscope, you guys sometimes put on a stethoscope to walk around to the canteen and etc. The best part is that you drive a car. Suddenly police stop you. Straight away you get a stethoscope to look into the dashboard. So the police say, oh, doctor, jalan. Yeah, right. So that's a requirement of stethoscope. But now things have changed. Stethoscope, now you can use electronic stethoscope, SETI for example. You can, those days I do a walk round. Then you hear a heart sound. Dudak, and then the lecturer asks you to listen. You don't know what you're listening. Can you listen or not? Yeah. You don't know. See. But now you can record the whole walk round. You can listen to the, and then comes to your handphone. You can record it and can share it. Can diagnose it. Your handphone can diagnose this is diastolic murmur, this is a Michelin murmur, PDA, and etc. All can be diagnosed. So now technology has changed. So the stethoscope is only for for the police, for example. So again, these are the technology is changing. So when you use your equipment, you have to think about, can we actually innovate the equipment to be used for other things? I'm running out of time, so I just want to go fast. Okay, and this is where we created CREST, Collaborative Research, Engineering, Science and Technology. Initially, this research is, this CREST is 50% funded by the company in Penang, and then all the private sector, and 50% in the government. Then it parked under MOSTI, but today they park under MITI. Why? Because they carry the value of creative ideas and innovation. Their office is in USM, near USM in Penang. And that's where you have ideas, you meet them, they can have electronic chips and all that. It's just like playing a Lego, you create your own equipment and etc. So CREST is a very important E&E industry in Malaysia. So this is how they support the industry in our national cardiovascular analytics and etc. So you can capture the information, data. Today everything is data. So continuous monitoring. Now even handphone, you can actually use your handphone and to come up with this. So these are the game changer for tomorrow. Mobility, today everyone have a handphone. Big data, you get access to the big data information, LLM for example, in AI and etc. in your handphone now. Artificial intelligence coming in every discipline of health. Every department is coming in. Now you must be part of it. Social media is already there, and we are using social media. Internet of Things, what we the devices that we have is all connected, and then cloud technology. So no more storage in server and etc. All in cloud technology. So these are all coming. Now the system is changing. Point of care. Those days, everything records all in the hospital, but eventually now it all moved towards the patient. In terms of principle, those days hierarchy, the top down, top down only, consultant and then surgeon and then registrar training. Then eventually now try to flatten it, partnership, partner with your subordinate, partner with the patient and etc. The physician role, those days, I tell you what to do. No, now no more. This is, I advise you, you are a guide, in terms of with the patient. In terms of data reference point, those days are all institutionalized from population. So we do cancer trial and all that population based. Now it's more personalized based now. In terms of individual rather than like for example those days chemo semua carpet bombing chemo, but now it's all very targeted to the individual. Whether you have this gene, whether you work with this. So sometimes you give a chemotherapy to a patient, sometimes it works, sometimes it doesn't, because it's very general. Now it's more specific, And health institution, the ownership of data, once upon a time the hospital owns everything, but now it's moving towards the patient. And knowledge, once those days, you need a library. I mean, when we are medical student, we go to the library here, actually dating semua kat library, But now, you see, you don't need a library. Everything in your fingertip now. Everything in your handphone. This handphone will cost you 3 million ringgit those days in 1980s. But now everyone have a handphone. Everyone can access to information. So how do you use social media, content media, crowdsourcing, funding, and etc. So this is an endless possibility of how we do things differently. So with new technology, job displacements is going to happen with AI, whether you like it or not. Some people fear about radiology, pathology, and etc. You still be there, but again, how to use? We need to have, it's been predicted by Science and Technology Foresight Malaysia 2050. Machine learning algorithm could do the work of 140 million people, and 30% of middle income jobs could be eliminated due to the AI. 6.3 million Malaysians could be affected through automation. That is actually 51% of current job. Can you imagine 51% of current job will be obsolete? Meaning today, those days we have someone frontline to answer call. Today you don't need someone to answer call. The chat box already can answer for you. In all languages, for example, you give a call, you think that you're talking to a person, you're talking to a robot. In terms of AI talking to you, and the voice is normal. And they can use your voice. Now you can use my voice. Many of them try to use my voice to promote traditional complementary medicine and all that. But my voice is me. Look like me. Sounds like me. It's not me, right? So these are the things that is technology. So anything innovation, there is a double-edged sword. That means for the good, the bad, and the ugly, whether you like it or not. So although this is scary, 50% of job will be obsolete, but you need to have a new skill, reskill, upskill, the talent diversity, lifelong learning, cross-industry. You also need to adapt to the new tool. Then you'll be relevant in time to come. So this is, what we think. Now, just to quote Sheikh Mohammed Rashid, the President and Prime Minister of Dubai, he mentioned that 2020, during the pandemic, is a very important time for all of us, because it has taught us unity. Public sector working with private sector, unity with working in government, whole of government, whole of society come together. And at that point of time, we appreciate family, unity, and etc. And more important is that, health is more important than politics and economy. That is the thing we are trying to say. Health is national security, and hopefully that we can continue to train a young population, young generation to take over from us. And this is sometimes I think we need calamity, we need challenges, and then only we can actually rise to the occasion. So, ladies and gentlemen, with that, thank you very much for your attention. Yeah. So, I'll be more than happy to answer any questions. Any question from the floor? Yes. Morning.
Enlightening talk. I'm pretty sure that you went through a very high level of stress. So can you share with us how did you manage and cope your stress level?
Yeah, a lot of people thought that I work, 24/7. Yes, I do. Those days also I work 24/7. I think the training that we have gone through, is very important in terms of communication. We break bad news. That's one important training. We get the stress in the operating theatres. There's also a stress, but I managed to adapt. And then those days when I was a medical student and a junior doctor, going for a presentation, conference, I got, 1 month to prepare and all that. Now, sometimes I only have 1 day to prepare or maybe a few hours to prepare. But again, because you've been trained over the years to do so, that's why I think you can manage the stress. If I were a newbie coming in, I couldn't manage the stress. But we have gone through all this, As I said, work is not a stress. Sometimes you enjoy the work, it becomes a pleasure. But handling the politicians is stress, right? Because that's my first experience, right? Because they want you to do the things according to them. Right or wrong is different. We have principle, we are professional. We do what is right. You don't ask me to do what is wrong. If you do what is right, I can actually support you. Alignment is there. Do what is right. But if you ask me to do what is wrong, I cannot sleep at night, right? Because we are not used to do what is wrong because someone else tells you to do. Then when you get into trouble, they say, I don't know. You are the one that actually implemented it, right? So this is the stress that we have. But you need to handle the stress well. Again, the trust, number 5, your prayers is important. Sometimes you want to make decision. The Muslim, you call it with sembahyang, solat istikharah. That means you're not sure whether you want to say yes or no. A big decision. Because I don't have a crystal ball. If I have a crystal ball, I can confidently say what to do. But we don't. So we need to have some prayers and then be sure. Also, sometimes, everything, we believe that everything already in place. But now we need to have the confidence of Almighty have said, they won't give you any, you are not given any challenges if you are not able to overcome the challenges. So that is actually comforting. So although you have a lot of tremendous stress, but then because you trust that, I think then, again, your subordinates all depends on you. If you cannot handle, everybody cannot handle. Because you are the frontliner, right? Okay, yeah.
Assalamualaikum, Tan Sri. Thank you for the talk. Tan Sri, I have one comment of gratitude and 2 questions. My name is Amirul. I texted you yesterday for that. Okay, Tan Sri, the comment of gratitude is you have been leading us a lot and you have introduced communication in your leadership, and that has become an anchor to your sub-leaders. And from me, because we are involved, my NGOs are involved in your strategic communication for vaccination and all, we are glad that you keep on repeatedly give some anchor to the points, which we would be hoping the next generation of leaders also having that. So thank you for that, Tan Sri. My first question is about how do you balance between your clinical duties and also leadership duties, because I think that is actually a strength and benefits for you, but of course there are challenges as well. My second question is about how do you develop your legacy, because of course we would want you to be our leaders forever, but of course you need to leave the position to someone else, and how do you maintain that leadership in your legacy? Thank you, Tan Sri.
So I answer the second question first. It's not about legacy. I am not here to create a legacy and all, etc. It's a social responsibility. So, and I serve in the Ministry of Health for 35 years. So that is a social responsibility. It's not that I'm not marketable. I've been the first Prince Court, with the CEO, headhunt for me, because they read my article, my journals, and etc. But each time I went, not only Prince Court, Sunway, even they have my pictures up there already, and then Pantai, KPJ, all offered me to join. But I always have this vision, team, Plan A and Plan B. Plan A is to serve in the public sector, in breast and endocrine surgery. Plan B, if things fail, then I go to a private. So I will develop international endocrine unit like Mayo Clinic, Leahy's Clinic. They're all private organization. But I think there's one I would like to share with you why I have not made decision. Almost interview, I went all interview, all accepted. The moment I want to step to private, I look back again. So when I was Form 4, Form 5, I got a scholarship now, of course, but not from JPA, scholarship from Majlis Agama Islam Wilayah Persekutuan, So, and I was the first candidate, given this scholarship. So very lucrative at that point in time. My colleague was getting 3,300. I was getting 4,000 ringgit, for one semester. So that's a lot of money. Then one day I was called before I accepted the scholarship, called by Ustaz Idris in Jalan Ipoh. So he said, ini duit orang Islam ni. It's not, not a scholarship that you can come from the bank. This is the people from the money. So he said, okay, no, nothing to sign. Just ambil sumpah je, bai'ah. Once you become a doctor, you serve the government until you retire. So that is what holding me. Kalau you tengok tak banyak pun, say 5,000 a month, 5,000 a year, 5 years of medical education, 25,000, 30,000, yeah. In 1 month you can actually work in a private, you can pay everything off. But there was actually a bai'ah, so it's not something that you sign, take you to court, nothing. It says, your conscience. Each time when I was offered in the private, so the moment I went for interview or accepted to leave, then you have this thought, I'm breaking the bai'ah, and after that the bad things will happen to me, money and all that. So that's why the concern. At one point of time, I have a control in 2018 or 2019. This was regards to in terms of prescription. So I always fight for public. Means I'm serving the public. It's not about me. As I said from day one, pandemic COVID is not about me. I'm not here for the glory, for the salary, or for the name and etc. Just do what is right for the people. So there was one pharmacy bill, the pharmacy bill, and I was not consulted, but it was tabled in Parliament. So obviously when I read in detail a pharmacy bill, meaning a doctor failed to give a prescription to the patient can charge you in court, found guilty, you can go to jail. I was disagree with that kind of statement, right? Not why you criminalize our doctor just because he did not give you this prescription. Yeah, in the normal times, maybe the doctor refused to give you a prescription. But if a drug addict comes to the clinic, I want a prescription of morphine, you don't give me, I charge you in court. Huh? So I was disagreeing with this factor. So again, there was a confrontation a bit. So then obviously the complaint went to KSN, etc. So I just said, accept my resignation, then I'm more happy. The happy means I break my bond now, because my bond is like, then I can go to private, right? This is, it's not that I have not, every now and then, all my friends go to private, because I know that I can do well in private. But then again, because of this, this promise I have, So if you have a sign a contract, JPA, you sign a contract, you break the bond, you just pay the money. Here is not the money. Here is actually, you don't know your undertaking, because you already have this bai'ah. So that's the reason why the time for retire. I was asked by Dr. Tuanku whether you want to extend. I said, no, I have done my part already. So 35 years in the public sector. So my career just started in the private and corporate sector. So I'm actually, retirement is a blessing now actually. So I'm enjoying my time. I'm still doing a lot of things. I'm still running my clinic. I'm doing my operation. In fact, I'm doing more operation. During being a DG, it's not that I want to be a DG, you see. I was offered earlier, and at age of 40, to be a deputy DG. 3 hours I was trying to convince me to take up the post. Then I said no, and then Islam American was a DG then. I said, you can keep the post, I'm not interested, I'm a clinician. Because what I want is actually continue to, in healthcare, in breast and endocrine surgery. Have I stayed on as a clinician, I would have write textbooks, publication and whatnot. Every year without fail, when I came back from Australia in 1998, 1999, every year without fail, I published 10 papers. 10 papers, textbooks in UK, textbook in Harvard, chapters here and chapters there. 6 textbooks already been published in chapters, and obviously, but then I rejected as the deputy. But when I rejected, someone else was taking the job, so things are not moving. Now you can see things are not moving. When things are not moving, at the ground level, so frustration is very high. So when you are frustrated, what do? You resign to private, right? Unless you change the system. So then I was offered again 3 years later, at the age of 46 or 44, I took up the deputy post, but with one condition, that I still can continue my clinical practice. So I have not stopped practicing as the deputy DG for 6 years. I still run my clinic. I still run my surgery once a week. And 6 years later, as deputy at 6 years, then I took up the DG post at the age of 49. And I was the youngest. It's not that I was appointed. It's not Pak Lah appointed me, but it was Datuk Sri Najib, because he said that, there were 15 candidates went for the interview. I was the last candidate because I was OC, came back, and he said, I'm still young to take up the post, then it will be longer. So obviously, when you see, I started in 48, 49, but I have a vision in terms of hepatitis C. Took me 6 years, and it was very challenging because the minister has been pressured as well. So a lot of things that, in Ministry of Health, it doesn't plan 1 year or 2 years. It is a long term. So, and we are still see the fruit of labor of hepatitis C. Global surgery, for example, took certain years. So a lot of projects, and then we have lean management in the Ministry of Health. So we improve the system. Not everybody have that kind of skill. So again, as I said, I have done my part. So I have moved on. And I do not comment. You see, I have no comment anything. Reporter keep asking me about comment about this policy, that policy. It's not my watch anymore. It's actually the current management, current minister, current management. It's up to them to decide. So I think that's okay. Again, it's not about me. I mean, I contributed. We all contribute to the healthcare, whether it's university, whether it's the Ministry of Health, and etc. Then we move on. And this is where I think I still continue with my international commitment. I'm still the board director of DNDI, Drug of Neglected Disease Initiative. I'm also the High Council of Global Surgery Foundation, and I was the counselor for International Surgical Society. And most of you will know that I just came back from Seoul. I'm the chairman of the Asian Association of Endocrine Surgeons, and also I'm the advisor for universal health coverage for WHO Western Pacific region. That's enough for my global commitment. But locally, I still continue to contribute, to share ideas and etc. But again, rather than get involved in politics, it's not that I've not been offered to join politics, but I'm not a politician, right? We are professional. So again, be a professional, live like a professional, walk like a professional. So I think that is the key. So that's about, it's not about legacy, it's about what we do. But then again, when you have the first question you asked me about, again, communication. So as I said, the communication skill that I have, and now I look back, then I understand why my childhood is a bit different compared to the others, So meaning to say that, I mix with Chinese, I mix with Indians, I mix with their culture and all that, and then I understand their culture better. So I would say that I'm a true Malaysian because I know the sensitivity and how to work. Here, when I was in UM, the Indian patient likes me. Professor John Bosco ran the hematology clinic. Normally I follow the clinic. All the Indian patients want to see me. So one day, Professor Bosco came to my clinic, my clinic, and then just to see why Indian patients want to see me, because I speak Tamil actually. So I communicate with them, and obviously the Chinese patient as well. So I think this is where the rapport. And once you feel the heart of the community, then you engage with them much better. So if you want to talk, some people use bombastic unity language to talk to the public. At the end of the day, nobody understands what you're talking about. So use simple language to communicate with your patient. And these are all training over the years. It's not overnight you become a leader. And sometimes everybody wants the post, but the question is whether you can deliver or not. If you cannot deliver, that post will haunt you. It's better for you not to take the post because it will tarnish your image as a leader, right? As a surgeon, you are very meticulous. I'm a very meticulous person. I cannot see RBC. My thyroid surgery is only one gauze. Even then, not so, right? One gauze. Nobody have seen. And then my assistant, even my CEO, founder also came to the operating theatre to see, is it true? Because only one gauze. That's a normal cases, not the challenging cases, straightforward. That is the routine. So very meticulous in surgery. That's why you can do a lot of cases. But when administration, you cannot be micromanaging. You must be a macro person. Trust your subordinate, empower them, trust them, and this is how I work as a team. Sometimes people cannot let go. People want to manage micro everything, cannot. So you must be top down, bottom up. So again, after 10 years as a DG and 6 years as deputy, I still do my clinical practice. Can you imagine if I stopped operating 16 years ago? So I won't have the skill back again. So that's why I think being a clinician, when you become an administrator, you must not forget and let go your clinical skill, because that's what makes you as a clinician first before administrator or even a politician. So I think that is the lesson learned. Again, not about you. It's about what you can do as that position. If you cannot deliver at that position, don't take that position, because that will tarnish your image. That will be your downfall, because you'll be known for the wrong reason rather than the right reason. So remember, this is a responsibility, whether you can deliver the responsibility or not. A long answer, actually. Any more questions? Ada lagi.
Assalamualaikum Tan Sri.
Salam, ya.
Saya Zurusdi dari Jabatan Kerja Sosial Perubatan. Bercakap mengenai kepimpinan, saya pasti sudah ada banyak cabaran dia sebagai seorang pemimpin, dan salah satu cabarannya adalah managing the people. Mungkin Tan Sri boleh berkongsi dengan kami semua tentang tips, memberi tips tentang how to manage the people, especially during the crisis.
Yeah. During crisis, managing people, there's all kind of people. You cannot have A team, all the good ones. No, life is not like that. You want to be involved in management, you must have skill to manage the best and manage the worst. Not only, I want to select my team, A team only. No, that is not a good manager. A good manager can manage the best of the people and the worst of the people. How do you manage? I have went through a lot of toxic people, believe me. But how do you manage them? This is the key. Again, you don't need to antagonize them. You just be systematic in the way you approach things. Use facts, data, and science. Sometimes they envy you. A lot of people envy us, right? Envy me, for example. So how do you overcome that? Again, it's not about me. I'm using social media, it's not about me to project, but then to share. Now dah retire, barulah I share, pergi jalan-jalan sikit, Dulu I mana ada, I just tunjuk what the needs to be done, what information needs to given to the public. Itu yang more important. What my key is that I think this is where, looking back after retirement, that every one of us are given, 1 year cuti 30 hari, and that is where I regretted, I did not take my leave, So work, and then I thought that I can golden handshake towards the end, that handshake entah ke mana, leave semua burn, that's where. So what happened is that the family suffer, right? Because now I advise all my junior, when you are given a leave, take the leave, take your family out and etc. Spend the time, don't accumulate the leave. Kita ingatkan nak accumulate the leave towards the end. So there was no end actually, and and the leaves will burn. So if only I've used up the leaf and be close to the family, that would be much better lah. So that is my advice to all of you lah. So people say I'm a workaholic. To me, work is my culture already in me lah. So you know, but if I look into it, I think your intention very important. So it work not because you nak dapat pangkat ke, gaji ke, harta ke. Now in the private, the biggest challenge in private is to charge the patient. You know, so kalau insurance, okay lah, I charge follow the fee schedule. Tapi kalau tak ada insurance, you know, makcik come here, sometimes I give free lah. You know, staff semua I bagi free. You know, so or charge 50% or something like that. So that's the most difficult task that I have to do lah. You know, but again, it's up to you because you nak charge, you charge. You tak nak charge, you can give free. So sometimes not everything boils down to dollar and cent. You know, again, this is the sincerity that you have. You speak with your, as I said, I shared all the listening skills, you know, your verbal and non-verbal communication, and that all helps you to build yourself as a good leader in time to come. Thank you.
Assalamualaikum, Tan Sri. Thank you very much for your inspiring talk for us today. I remember those days during the COVID crisis when you did your PCs. We could see people surrounding you, standing behind you. Some of them were very powerful people. And one thing that I would like to ask for your tips actually, how do you communicate with the most powerful people in Malaysia, especially when your decision, when they against your decision, and how do you encounter them? So to make them empower with you.
Because there's no playbook during the pandemic, nothing to refer to. The only information you have is learning from countries that have gone through the pandemic 6 months earlier. That's number one. Second is that you need to fall back on fact, science, and data. You know, table the fact, science, and data to them. Not my feeling. This is the data. We don't do this. This is what happened. You know, and also we have every morning we have a meeting. 8 to 9, I have a meeting in the Ministry of Health with all the agency, and then they will advise me what to do or what to say and etc. Then 9 to 10 and 11 o'clock, there's a Majlis Keselamatan Negara National Security Council meeting, whereby I will table the situation. So I will table to them, okay, nothing been done, this is our projection. This is the outbreak, this is where the outbreak going to be, projection will be there. If we do right, this is where we have. So it's already been tabled data form. So you know, if you don't do anything, this is where you're going to be. If you do something, this is where you probably will come. So you decide. So table the data, everybody you decide. You want here or you want there. All documented. And you cannot say, oh, I forget about it, I didn't know. Every day we capture the information. Decision we made, whether it's the right decision, wrong decision, it must be based on facts, science, and data. You know, it's not my feeling. My feeling, everybody can contradict, right? Because that's what you feel. But this is the fact, science, and data coming from all the institution, department, you know, IMR, you know, INH, and etc., all giving the input. And this is the data that we have. So it must be based on science, facts, and data. So because otherwise you cannot convince the public without science, facts, and data. But your role is to digest the data, simplify it, make it easy for a layperson to understand. That is your role. Rather than creating, I don't create data. You know, the data is that I was challenged to release the data to the opposition at that point of time. So you know, even when you say half empty, they will say half full. You say half full, they will say half empty, right or not? Based on data. So it's very difficult. If I give the data set, they don't want data that I announce. They want the data set, the basic data. So they can interpret whatever they want. So we interpret positive, they interpret negative. You know, that's how they can do it. So and then you have been pressured. You know, you hide data, you don't want to share data. So what do? So when I discuss it, think about it. Okay, we share with the whole world. That means we release the data set to the whole world. That's why the Lancet publication acknowledged Malaysia is the first to share the data with the whole world. Why? Because I want institution, like learning institution, academic institution, to analyze our data as well. And then they will give us a feedback whether we are doing the right thing. So if all the institutions say this is the right interpretation and this is the right data, you cannot use that to go against us. Right or not? So this is transparency. So that's how you must think of solution, because otherwise you'll be pushed to the wall. When you are pushed to the wall, that's where innovation and creativity come in, right? If you are not pushed to the wall, then you relax. There is no innovation, right? When you push to the wall, hepatitis C, we were pushed to the wall. You know, you tak bagi kita voluntary license. Thailand took the voluntary license. The cost of treatment in Thailand is $1,500. In Malaysia, it's $60. And because why? You use compulsory license, you know. And once they threatened me as well. Okay, I give you 5,000 original medicine, but you don't use compulsory license anymore. And then we give you voluntary license. I say no. Now that we have used, you know, compulsory license, then you want to give us the voluntary license. Let's float it to the market, competitive market pricing. If your pricing is cheaper than my compulsory license, no reason for me to use compulsory license. Betul tak? So that's what I told the company. You know, then we float. And then the company also very bad. They complained to Trump, President Trump, and as well as the ambassador. They kata nak bagi voluntary license, Malaysia do want to receive the compulsory license. You know, and then insist on using compulsory license. I said no, we accept. We'll release it. The pricing, everything released in public, very transparent. Everybody can see competitive market pricing. So when their pricing is cheaper than compulsory license, then we stop using compulsory license, and then only voluntary license. Then they kata, the company said, we don't mind if Malaysia aja use a compulsory license, diam-diam sudahlah. We go the whole world and talk to the whole world. You know, we won in Colombia, we won in Argentina, award sini, award sana. You know, China pun belajar dari kita. Everyone is learning from us. You know, the way we do things differently. Itu yang dia tak tahan tu. You know, using compulsory license. So I think these are the thing. Again, based on fact, science and data. Ada lagi question? Okay.
Assalamualaikum Tan Sri. Saya Muhammad Adib daripada Jabatan Onkologi. Saya nak tanya macam suggestion untuk kita orang, saya yang muda, untuk jadi leadership yang bagus.
Itulah macam Mai kata tadi, yang 5 perkara. Pertama, your skill. You must have a good listening skill lah. Dengar pada fakta, verbal communication, non-verbal communication. You must be able to communicate, risk communication dengan patient macam saya ulang tadi. Sebagai leader, you kena ada creative ideas and innovation. Jaga anak buah you. You jangan guna kuasa untuk suppress anak buah you, because bukan team, bukan atas bawah, as a teamwork. Itu yang penting. Kerja berpasukan. And the last but not least, I think istiqamah dalam apa pekerjaan kita, and tawakal pada Allah SWT. Itu yang paling penting sekali.
Majlis mengucapkan jutaan terima kasih kepada yang berbahagia Tan Sri Datuk Sri Dr. Nur Hisham bin Abdullah di atas perkongsian sebentar tadi. Hadirin sekalian, dengan demikian maka sempurnalah sudah program Leadership Talk Siri 1 tahun 2025 pada pagi ini. Majlis sekali lagi ingin mengucapkan jutaan terima kasih kepada para hadirin kerana kesudian hadir pada sesi program Leadership Talk pada kali ini. Setinggi penghargaan juga kita ucapkan kepada yang berbahagia Tan Sri Datuk Sri Nur Hisham bin Abdullah di atas ilmu dan pengalaman yang dikongsikan pada kali ini. InsyaAllah diharapkan dengan lebih banyak sesi Leadership Talk Series akan diadakan lagi pada tahun ini. Baiklah hadirin, sebelum kita mengakhiri majlis, hadirin dijemput untuk sesi bergambar sebagai kenang-kenangan.